A mother of 3 has revealed she was unconscious during both of her daughters' births. Sharon Deacon delivered her first child as doctors tried to restart her heart, and for the second she was under general anesthetic, due for a Caesarean section on January 8, 2015 while pregnant with her daughter Jamie-Leigh, now 3. Ms Deacon's heart suddenly stopped, causing her to slip into unconsciousness. Doctors advised Ms Decon, 42, from Keighley, near Leeds, not to another child. However, desperate to give her daughter a younger sibling, she went against their advice and became pregnant again in late 2016. As she prepared to undergo another C-section, doctors were forced to administer a general anesthetic after the local failed, causing Ms Decon to be unconscious during her child's birth for a second time, waking an hour later. Doctors told Ms Decon her newborn daughter Ellie-Marie suffered from the rare disorder Pierre-Robin's sequence and nearly died, without her mother ever having the chance to meet her. After spending 3 months in intensive care undergoing multiple surgeries, Ellie-Marie was allowed home in time for Christmas but suffered another setback last January when her surgical breathing tube became dislodged. Now stable, Ellie-Marie's family are speaking out to raise awareness of the charity Sick Children's Trust, who provided them with accommodation near the hospital while the youngster was treated. I delivered both my girls unconscious. Speaking of Jamie-Leigh's birth, Ms Decon, who has a son Joshua, now 14, from a previous relationship, said, as one team of doctors battled to resuscitate me, another team delivered my baby girl, Jamie-Leigh. We were both fine, which was amazing. Ms Decon, who suffered from gestational diabetes during both of her later pregnancies, said, I've delivered both my girls unconscious while Ellie-Marie was in hospital. Her family were supported by the Sick Children's Trust, who provided accommodation away from home. Ms Decon, whose partner Darren, 47, works at B&Q, said, they were amazing. We stayed in a room near the hospital nearly the whole time. Pierre-Robin sequence, PRS, occurs when babies are born with a noticeably smaller jaw, which causes breathing difficulties due to their tongues being further back. Some sufferers may also have a cleft palate. PRS affects around 50 babies a year in the UK. Between 50 and 80% of these infants have other health complications. In the US, around 1 in 8,500 to 14,000 newborns suffer annually. PRS cause is unknown but is thought to occur early in pregnancy and may be linked to their mother suffering a viral infection or having insufficient folic acid levels. Most PRS sufferers grow up normally but may experience breathing and feeding problems in early life and therefore need to be monitored. PRS sufferers' jaw bones usually become normal by adulthood just by growing out. Breathing difficulties and cleft palates require specialist hospital treatment. Source: Cleft Lip and Palate Association. I didn't wake for 2 days. When I did, I had a daughter as well as gestational diabetes. Ms Decon suffered from preeclampsia, which caused her to suffer dangerously high blood pressure while pregnant with Jamie-Leigh. As a result, she was told at just 35 weeks she would need to have a cesarean the following day. Ms Decon said, I was then taken to theater for an arterial line to be fitted. I had a nebulizer on my face but wasn't unconscious. But suddenly, I felt my chest tighten. That's all I remember. Doctors at Airedale General Hospital managed to resuscitate her and delivered her baby. Jamie-Leigh weighed 6 pounds 6 ounces and, while she was taken to neonatal intensive care as a precaution, was healthy. Ms Decon said, I didn't wake up for 2 days. When I did, I had a daughter. She was too unwell to visit Jamie-Leigh in neonatal intensive care for more than a week, which made their first meeting even more emotional. A month later, while back at home, Ms Decon was told the cardiac arrest had triggered her chest pain. Although doctors advised Ms Decon not to become pregnant again, she said, I wanted a sibling of the same age for Jamie, so I disobeyed the doctor's advice. It was me who was meant to be at risk, not my baby during her second pregnancy. Ms Decon once again developed gestational diabetes. She said, this time the doctors were more prepared. I was under very specialist care at Leeds General Infirmary (LGI), and a cesarean was planned for July 2017. Yet, as if the local anesthetic failing and Ms Decon being put under was not enough, Ellie-Marie was born seriously ill. When the umbilical cord was cut, the youngster was unable to breathe and nearly died. Ms Decon said. It took the doctors more than 45 minutes to establish an airway, and all that time Darren watched on helplessly, fearing I might never get to meet our new daughter because I was unconscious. Finally, they managed to incubate her, inserting a tube so she could breathe, but it was a huge struggle. Waking an hour later, Ms Decon listened in horror as doctors explained what had happened to her baby. She said, "It was me who was meant to be the one at risk, not my baby. I had to wait a few hours before doctors would allow me to see Ellie-Marie. Darren and a nurse took me to see her in a wheelchair, in a room on her own, with a nurse watching over her, hooked up to a ventilator with tubes and wires all over her tiny body. My heart broke. I felt helpless. I couldn't even hold her." Ellie-Marie needed surgery at just 2 days old and then again 16 days later. The operation involved creating an opening at the front of her neck to insert a tube into her windpipe that allowed her to breathe. The youngster spent 3 months in hospital before eventually being released in time for Christmas. Although home, Ellie-Marie's health issues were not over, as earlier this year, her breathing tube became dislodged, leaving her unable to breathe. Ms Decon said, "Thankfully, she was saved again. Now she is back at home and we treasure her and her siblings." Everything initially seemed to be going well, always wanting to expand her family. Ms Decon was delighted when she became pregnant with her first daughter in the summer of 2014. She said, "Darren and I were over the moon. We wanted a baby and everything initially seemed to be going well." The couple were told they were having a girl at their 20-week scan at Airedale General Hospital and began excitedly preparing the nursery and discussing names. Yet, following blood tests at 20 weeks, Ms Decon was diagnosed with gestational diabetes, although her condition was initially controlled via diet and then medication. By week 8 she had developed preeclampsia. Ms Decon said, "I wasn't initially worried. I'd suffered from it with Joshua. So he was delivered 6 weeks early and weighed 3 pounds 14 ounces, but now he's strapping more than 6 feet despite her relaxed attitude." Doctors admitted Ms Decon to hospital, where they ordered bed rest while being monitored. Her blood pressure started to rise within days of being admitted. Find more information on the Sick Children's Trust here.